You have seen this in social media. I have cured my RA by quitting gluten. You have also read this blog that said bread is a poison. You are in pain. You are looking for answers and you start to wonder, is this the truth? Is gluten the villain behind my pain? Today, we are going to replace these confusions with some clarity. Hello, RA warriors. This is Dr. Ananta Subedi, your rheumatologist, and my job today is to help you learn about the science and the facts that help us understand whether truly the gluten is a culprit or not. And I want to help you build a plan that works for your body to fight against rheumatoid arthritis. And speaking about a plan, if you feel you are overwhelmed by all this dietary advice and misinformation, don't forget to get those free downloads in our comment below, which includes 3 critical steps you need to do when you have a new diagnosis of RA and 3 critical steps you need to avoid with the rheumatoid arthritis diagnosis. And don't forget your free copy of the book that explains all of those concepts in much more detail. Now, let's get back to the most important question. What is the role of gluten in rheumatoid arthritis? Is gluten yes or no if you have rheumatoid arthritis? Many of you who have rheumatoid arthritis, you know you have pain, you feel tired, and you go online late at night just looking for some answers on how you can feel better. And you see a story of someone who quit gluten and now they are running a marathon, and you feel a little bit of hope, but you also feel a dread. You think about your family's dinner, you think about those birthday cakes, you think about how hard it will be, and you feel fear. What if I cannot do it perfectly? What if I cannot enjoy that birthday cake? And such feeling is normal. We are humans. Fear is part of who we are. This food fear is a heavy burden to many of our rheumatoid arthritis patients. And my goal today is to help you lighten that load of fear. And let me start with a story of one of my patients. Let's call her Sarah. She came to my clinic, and I remember I was sitting on my stool facing towards her, and I was looking at her chart. I was feeling happy. I saw that her inflammation marker were perfect. Her joint exam was normal when I examined her joint. Her RA was in good remission. There was no activity of rheumatoid arthritis. And I was thinking, this is fantastic. This is a win for her and win for me because she's feeling better. We found the right medication and she's doing great. And this is time to celebrate. But to my surprise, when I turned from my computer to look at her, she was not celebrating. She was not happy on the exam table. And I softened my voice and I asked her, Sarah, your lab looks perfect. Your exam is normal. This is a great news, but why are you feeling this way? Why are you scared? Why are you not happy? She said, I'm scared, doctor. My daughter's 10th birthday is coming this weekend, and I just want to have a piece of cake in her birthday, but I'm scared of gluten in the birthday cake. She also told me, I have read this article that says that the gluten can cause rheumatoid arthritis and it can cause flare of rheumatoid arthritis. So she was very, very confused and worried. Now, her comment hit me in my chest. Here is a woman who has rheumatoid arthritis that is well controlled. Her labs are looking good and she is doing well, but she is in a lot of fear of this uncertainty. That's why the villain here is not the rheumatoid arthritis anymore. The villain is the fear, the misinformation. After the discussion, I moved closer to her and I said, Sarah, thank you for telling me your story and your concern. Let's separate the science from the fear of gluten. And that's what we are talking today. We'll be going over the science behind what is the role of gluten in rheumatoid arthritis. So let me break down the complex concept of gluten and science to make it simple. Now, first question comes up is, what is gluten? So gluten is simply a protein. It's found in grains like wheat, barley, and rye. What makes the bread stretchy and gives pasta its chewy texture. Now, there is one disease where gluten is 100% without any doubt the main villain, and that is a celiac disease. So celiac disease is also an autoimmune disease like rheumatoid arthritis. When a person with celiac disease eats gluten, their immune system does not attack their joints. It attacks their own small bowel. This causes pain in the stomach, bloating, diarrhea, and stops them from absorbing nutrients. So the celiac is not a joint-related problem. Now, occasionally you might get some joint pain, but it's not a common symptoms of celiac disease. Now, you might wonder, what is the link? What is the connection between rheumatoid arthritis and celiac disease? Now, here's the most important connection. So a study has shown that people with one autoimmune disease are at a slightly higher risk of having another autoimmune diseases. And there has been some studies, one in particular that was published in 2017 in Journal of Rheumatology International confirms that patients who have rheumatoid arthritis have a slightly higher risk of having coexisting celiac disease compared to the general population. It's not a huge risk, but it's a real risk. That's why in my practice, I usually ask this question to my patient, whether they have any bowel symptoms. And if they have, I do test them for celiac disease, because of the fact that there might be coexisting celiac disease with rheumatoid arthritis. And it's done by a simple blood test, and that can help us guide whether my rheumatoid arthritis patient also has coexisting celiac disease. And if the test is positive, the answer is we need to avoid gluten in those patients. You must be 100% gluten-free if you have celiac disease. It's the medicine for celiac disease by avoiding gluten. But if you don't have celiac disease, you may not necessarily need to do those. Now, some of you who have rheumatoid arthritis and who are not positive for the blood testing for celiac disease, then you might be asking, do I really need to avoid gluten? Now, the answer is it depends. Now, there are some people who may not be diagnosed with celiac disease based on the blood work, but there is another condition called non-celiac gluten sensitivity, also called NCGS. What this basically means is these people may have a negative blood test, but they may not be able to tolerate gluten-containing diet. And you can experience such symptoms. If you have this condition, you may still feel poor, you may still feel bloated, you may still have some bowel symptoms, but your blood tests become negative. That's what we call non-celiac gluten sensitivity. And it can also sometimes cause fatigue, and sometimes it can also cause achiness in your joints. So in this situation, it might be worth looking into avoiding gluten if you have those symptoms related with gluten-containing diet. So let me quickly recap on what we talked so far. So people who have rheumatoid arthritis, they might be at slightly higher risk of having celiac disease, which could be tested with blood testing that is ordered by your doctors. And if you have both rheumatoid arthritis and celiac disease coexisting together, we do recommend avoiding gluten. And there's other condition called non-celiac gluten sensitivity, where you could be sensitive to gluten. In those cases, you can also feel better if you avoid gluten. Now, the other common question I always hear from a lot of my patients is, does gluten cause rheumatoid arthritis? Now, let me be very clear. I want you to hear this. Based on all the science we have, based on all the studies we have so far, the short answer is no. There is no strong scientific evidence that says gluten causes rheumatoid arthritis. So you don't have to be scared with gluten. So you can feel reassured that your bread that you are eating is not causing your rheumatoid arthritis. Some of you might have this question. Why do some people feel better if they avoid gluten? Now, this is a very important question, so pay attention to me. If gluten doesn't cause RA, why some of you who have rheumatoid arthritis do feel better after you quit taking gluten? And there are a few reasons I will highlight here. Now, they might, or you might have undiagnosed celiac disease. That's why, as we discussed earlier, testing is your step one to understand whether you have celiac disease or not. Number two, you might have what we call non-celiac gluten sensitivity. The inflammation from this sensitivity could make their RA or could make your RA symptom feel worse, even though your blood test could be negative. Now, the third reason, which is very interesting and it's kind of confusing too, and we call that healthy user effect. And what it means is, let me explain. When people quit gluten, what they typically do, they stop eating pizza, pastries, cookies, and processed food, and they start eating more healthy foods like fruits, vegetables, and whole foods, which in itself make you feel better. Now, they are not just quitting gluten, but they are adding better food, which helps your rheumatoid arthritis. That's why we call this healthy user effect. That might be making them feel better. It's not just the gluten. Now, let me go back to the most important question we talked in the beginning. Is gluten yes or a no? And my answer is, it depends. It depends on whether you have celiac disease or not. It depends whether you have non-celiac gluten sensitivity and how is your other diet. So those factors typically affect the answer, whether we should avoid gluten or we should continue the gluten. But one of the most important concepts is you don't need to be in a fear-based diet plan. You need an empowerment diet plan. And this is where our NESSCAR, NESSCAR framework comes in. We don't need to guess. We can use the N for the nutrition in our NESSCAR framework and then the C for the checkpoints. And the checkpoint is where you stop, check in with your body and check in with your own doctors and check in with yourself what you are eating. Can we modify certain thing in your diet, or can you eliminate certain thing in your diet and add something better? And the other important one is the S of the NESSCAR, stress management, and then the R for the relationship of our NESSCAR framework. Now, if you are stressed with your diet plan, that might itself be causing your RA flare. So that's why try to minimize that stress of what to eat and what not to eat. Now, going back to our story with Sarah, and I told her at the end of the visit, go to that birthday party, be present with your daughter. That relationship, that joy, that is more healing for your body than the perfect diet. The fulfillment you get from that moment is what we are fighting for. And that is what will help your rheumatoid arthritis, not the fight of yes gluten versus no gluten. Now, after a couple of months, she came back to me and I asked her about the birthday party, and she smiled and she said, I had the cake. It was delicious. And Dr. Subedi, nothing happened. I felt fine. I didn't have any flare of the rheumatoid arthritis. The fear was the problem, not the cake. Now, I sat down with her and then discussed about our NESSCAR framework. I told her, this process of finding your personal triggers and learning to listen to your body is a key part of our NESSCAR framework. It's about moving from confusion to the clarity. Okay, RA warriors, let's recap what we talked today. Number one, fear and misinformation are real villain in your rheumatoid arthritis journey. Do not let this food fear steal your joy in your life. Number two, there is no strong scientific evidence that prove that gluten causes rheumatoid arthritis. But sometimes you could have celiac disease along with rheumatoid arthritis. So check with your doctor if you have any gut-related symptoms to get it checked for celiac disease. And before I leave, let me give you 3 action plan for today. Number 1, ask your doctor if you need to get tested for celiac disease if you have any symptoms. Number 2, start a simple food journal that will help you guide what food could trigger your pain or trigger your flare of rheumatoid arthritis. Number 3, focus on adding some anti-inflammatory food in your diet. Rather than thinking about what not to eat, add some better food such as berries or colorful fruits and vegetables that are strong anti-inflammatory that could help with your rheumatoid arthritis. With all this formula, you can move from a confusion to a clarity. Now, if this video helped you today, please click that subscribe button. We are building a community of empowerment for rheumatoid arthritis warriors, and I would love to hear from you regarding your experience about gluten and rheumatoid arthritis. And if you have any other questions, please put them in the comment below so that I can create similar video for the future. Don't forget to download some of the good tools that we have created for you to fight against rheumatoid arthritis, including a free copy of our book that has more extensive information regarding what we talked today. I'll see you in the next video. Bye-bye.